I'm Brayton Shirley. I'm a fellowship-trained joint replacement surgeon with the Steadman Hawkins Clinic. I've been with the group now 5 years and focus on hip and knee replacement as well as hip preservation surgery. The surgery experience in general for most patients is scary, and a lot of people don't know what to expect, and we want to help ease those fears prior to surgery. And so we spend a lot of time talking about the surgical process, what to expect before surgery, what to expect in the hospital, what to expect going home. And the more patients are equipped with knowledge and an understanding of the process, the more comfortable our patients feel, the easier the recovery often is. I see a number of patients from near and far who are interested in the anterior supine approach for hip replacement, and this is something I've been doing now for about 2 years and have done several hundred at this point, and this surgery has really advanced hip replacement, and in my opinion. It allows us to get to the hip between muscle, and so we do not have to cut or remove muscle in order to complete a hip replacement, and patients tend to see a quicker recovery. They get rid of their limp faster. We're able to allow them to bend over and tie their shoes from the beginning of their recovery. And the surgery also allows us to place the hip components with a lot greater precision than our traditional approaches. It's something I really believe in. I'm very enthusiastic, and many of our patients are very good candidates for the direct anterior approach for hip replacement. When we're talking about the surgery process, I want my patients to have trust in me and trust in the process going forward. And so education is a very valuable aspect of this. Patients need to know what to expect prior to surgery, while in the hospital, and what to expect when they go home after surgery. I grew up in Charlotte, North Carolina. I went to undergrad at UNC Chapel Hill, then to Medical University of South Carolina in Charleston. I did my residency training in Greenville with the Greenville Hospital System, and then I went to Salt Lake City, Utah to work with Dr. Christopher Peters and Harold Dunn in adult reconstruction or hip and knee replacement surgery. And Dr. Peters is world-renowned as a hip preservation expert, and it was in Salt Lake City where I gained my experience with periacetabular osteotomy and hip preservation as well as hip impingement problems. Some of our patients have heard that there are no options left for their painful hip problem, and we have a very specialized technique to preserve the hip for certain patients with hip dysplasia or problems with the direction that the hip socket is oriented in. And so this procedure is called periacetabular osteotomy, and it's a very powerful and successful procedure to restore coverage of a hip socket that's shallow, or to reorient the hip socket. When it points backwards, we can make the hip socket point forwards, and this can eliminate impingement. I remain the only surgeon in South Carolina who performs the periacetabular osteotomy, and I've now done dozens of these procedures, and it has been a very powerful, very successful, and rewarding procedure to perform. And I've seen a lot of patients have a lot less pain and better function, and even return to high level of sport participation following this procedure. I've recently started riding a mountain bike pretty regularly, and Greenville's blessed with some good mountain biking trails in close proximity, and so when I can get away, I'll get on my mountain bike and work up a sweat, try not to crash, but have a lot of fun on the mountain bike. And I like to fly fish when I can get away, and anything I can do outdoors usually leaves a smile on my face. I have a wife and 2 kids, a 4-year-old boy, a 2-year-old girl. I really enjoy spending time with my family. They're very important to me. I really enjoy seeing my patients who have a lot of disability and pain, and some who can't walk, come back and watch them walk again for the first time, and some in many years. And seeing our patients feel better, have less pain, have the twinkle return in their eyes is definitely the most rewarding aspect of what I do.